The ultimate goal of managing and treating carotid artery disease is to prevent a stroke, but stroke can also be caused by the treatment procedure itself. Today, the majority of patients with carotid disease are treated through an open surgical procedure called carotid endarterectomy, or CEA, which requires a large incision on the neck and can lead to nerve injury, infection, and even heart attack. The minimally invasive approach through a transfemoral access point in the leg has historically delivered a procedural stroke rate 2 times the rate of CEA. A promising new alternative to CEA comes from Silk Road Medical. Engineers at Silk Road Medical work closely with vascular surgeons to develop a procedure called transcarotid artery revascularization, or TCAR for short. A clinically proven, less invasive, and more efficient approach for carotid artery disease treatment. The TCAR procedure places a catheter directly into the carotid artery to temporarily reverse blood flow to remove embolic debris that could break loose during the procedure. The 1.4% TCAR stroke rate is compelling, especially considering the TCAR patients are at high surgical risk versus the CREST study standard surgical risk patients. With TCAR, everybody benefits. The less invasive procedure produces a much smaller scar than CEA, with less chance for nerve injury and overall discomfort. TCAR is also better for the vascular surgeon. The TCAR 30-day all-stroke rates in high surgical risk patients are lower than the stroke rates in standard surgical risk patient in the CEA arm of the CREST study. Hospitals and patients will appreciate TCAR as procedural times are 1/2 that of CEA, and length of stay is about 1 day shorter. The TCAR procedure, giving patients, physicians, and hospitals excellent outcomes in a less invasive, more efficient patient-friendly approach to carotid artery disease therapy. To find out more about the TCAR procedure and how it can benefit you, visit Silk Road Medical at silkroadmed.com.